our way to Port Alberni. We're going to the VIHA board meeting, and we want to talk to them about their plans with the new care delivery model redesign.
VIHA is mandated to cut jobs for RNs and LPNs and are replacing them with care aides.
I don't feel it's advocating for patient safety, what management and VIHA is trying to do.
The patients need access to nursing care, and they're taking that away from them.
I want to know that when my family members or people I care about and members of the public are in the hospital, they're actually getting the care that they deserve.
CDMR has got to go! Hey, hey! Ho, ho! CDMR has got to go! Hey, hey! Ho, ho! CDMR has got to go! Hey, hey! Ho, ho!
I'm the acting CEO of VIHA, and we're very happy to be here in Port Alberni, and we would like to acknowledge there's a number of members of our staff.
Give this a second thought, because it's hurting patients, and we're here for the patients.
I went into nursing to make a positive change for people, and if people can't do that, you're going to have a bigger human resource issue when nurses are leaving the profession, really great nurses.
I was on one of the floors that was closely studied. I was followed with a clicker. When I walked Mr. So-and-so to the bathroom, I assessed his gait, his neurological problems, his mental status, etc. So we do these tasks, but they aren't just tasks when they're done by a trained professional.
I don't believe other professionals like doctors or dentists are being followed around and having their work measured in minutes and steps. Their work is measured in outcomes, as so should nurses as professionals.
We are absolutely committed to the care of our patients. And if the cuts are made here and now, where is the next place?
I'm wondering if any of the physicians or surgeons at NRGH were polled or asked their opinion about this, because all of the nephrologists and internal medicine doctors that I work closely with are appalled.
When CDMR was announced at NRGH, it was done in the most disrespectful and hurtful manner to nurses. We had managers and directors show up on the units announcing that nursing positions would be cut at the nurses' station in the middle of their busy shift. And when the nurses were in shock and outrage, some of them even crying, saying, "You cannot take away our nurses," the directors laughed at them and walked off the floor. That's completely unacceptable.
Shame.
Shame.
I wasn't aware that we're, and so what you've described to me is not what I understood, and so I'll have to understand that better, and so we will.
But most importantly, it's about the ratio of nurse to patients here. When you start putting in these care aides and taking out the licensed, regulated nurses, we're now looking at one of those regulated and licensed, educated nurses looking after 7 to 10 patients. The further you go from 4 patients to 1 regulated health professional, the higher the level of mortality and morbidity. This includes pneumonia, infections, bed sores, readmissions. So we are moving away from optimal care. I would say that this needs a serious reevaluation and a serious commitment to working with our members to develop a care team that really works for the patients.
Yeah.
This did not start as a cost-saving exercise. It started as how can we meet the needs of our patients differently? Because we're not meeting the needs. I'm sorry, but all of you professionals,
You're not meeting the needs.
Just because we don't agree with the evidence that you put forward, doesn't mean that we haven't listened to you. Doesn't mean that we haven't taken into consideration your point of view. But we do need to advance, and we will continue to do this.
We're very concerned what's going on with the skill mix changes, replacing 28 RNs and LPNs with 31 care aides at Nanaimo Regional Hospital, and we're very concerned, and we want to know what's going to happen in South Island. Our members too are very concerned that this isn't good for patient care, it's not good for nurses.
It's this kind of campaign, this kind of organization by the members that's going to be part of our ongoing struggle until we really get them to understand that we need to have some say in what the staffing looks like on our nursing units.
They did say that they would take our concerns and they've heard them loud and clear, and that they would get in touch with us at a later date and have conversations with the union. And that was basically one of the second ask that we were trying to get out of it. So we did get kind of a 50-50 partial win out of it, and I think it was good for the nurses also to be here to tell their stories and voice their concerns, and we needed the VIHA board to hear that, and so that in itself is a success.